everyone, my name is Cameron Sarker. For this literature review, I'll be discussing the prevalence rate of mental health among high school teens, the logic model of the problem, the logic model of change, and potential intervention targets. According to the CDC, in 2019, more than 1 in 3 high school students had experienced persistent feeling of sadness or hopelessness. There was a 40% increase in that number since 2009. 1 in 6 adolescents has reported to make a suicide plan in the past year. This was also a 44% increase since 2009. Depression is the leading cause of disability globally among adolescents. In the United States, 12 months of prevalence rate when it comes to depression has increased from 8.7% in 2005 to 13% in 2017. According to the World Health Organization, 1 in 7 10 to 19-year-olds experience a mental health disorder. This accounts for 13% of the global burden of disease in this age group. Lifetime prevalence of depression increases dramatically for individuals under the age of 12 to adolescent. Depression increased from 1% for population under the age of 12 to nearly 25% for adolescents. Drug misuse for the age of 17 is 25%. Individuals who are between the ages of 11 or above, the prevalence rate of impulse control disorder is approximately 50%. Lastly, approximately 800,000 individuals die due to suicide every year. This means every 42nd, an individual take their life. Suicide is the third leading cause of death for people between the ages of 15 to 24. According to the data that was provided, girls are more likely to attempt suicide than boys, but boys' attempts are 4 times more successful compared to girls. Now I'll be discussing the logic model of the problem for spreading awareness about mental health among high school teens. The logic model of the problem contains personal determinants for teenagers who are at risk for mental health issues. These personal determinants are depression, anxiety, attempt at suicide, self-harm, self-esteem, poverty, and socioeconomic background. Personal determinants could lead to behaviors that may put individuals more at risk, such as self-harm, multiple attempts of suicide, substance abuse, bullying, and impulsive behavior. Other personal determinants of environmental factors that affects an individual are lack of knowledge about mental health, lack of access to resources, and lack of support from the school. Peer education, intervention, focus groups, and school programs are created to give students a support system as well as create a healthy environment where they will be able to openly discuss their mental health. Environmental factors that goes hand in hand with personal determinants are lack of social group, stigma against mental health, poverty at home, and school environment. These health behaviors can lead to health problems such as depression or symptoms of depression, and it can affect the quality of life by leading to suicide, low self-esteem, lack of confidence, lack of motivation, and self-harm. Next, I'll be talking about the logic model of change for spreading awareness about mental health among high school teens. It addresses the program's targeted outcome and objective. The behavioral outcome that the program wants to achieve is increasing knowledge of mental health among teens, reducing the suicidal rates among teens, and use of available resources. In order to achieve these behavioral outcomes, the program will have objectives such as identifying warning signs and risk for depression and anxiety, accessing available resources, and engaging in preventative strategies. The determinants for health behavior outcome were perceived severity of negative mental health among teens, perceived susceptibility to depression, anxiety, and suicide, and perceived benefits of preventative resources and awarenesses. The health belief model was used for this theoretical framework. It can enhance the ability to spread awareness to high school teens about mental health. The environmental health outcomes that are expected to be achieved through the innovations are increasing awareness of mental health and its risk among high school teens, reducing suicidal rates among teens, and using available resources to increase awareness. In order to achieve these outcomes, the program will use objectives such as identifying warning signs of depression and anxiety using preventative measures, delivering prevention resources, and providing focus group support. The determinants for environmental outcome are lack of knowledge concerning negative mental state among teens, lack of self-efficacy to provide preventative resources and benefits, as well as attitude concerning mental health and prevention. Lastly, social network theory was used for the theoretical framework because evidence suggests the lack of support can lead to depression. The potential target audience for this intervention will be teens in high school. According to many research that were done, it shows that teens' mental health due to COVID-19 have become much worse. This program will actively try to educate, connect, communicate, and spread awareness among individuals who may not be aware about teens' mental health. The program will also have trained professionals who will be there to hold informational sessions as well as educate and spread awareness about mental health. Weekly focus groups will be also available for teens who want to communicate with others about their concerns, as well as they will be able to know that they are not in this alone. Lastly, the program will ensure that the participating members have access to resources. The following are my references for my literature review. Thank you.